Hello and welcome to Health Professional Radio. My name's Toby Longhurst, and joining me in conversation is Dr. Myles Holt. Dr. Holt is the head trainer of the Australasian Academy of Dental Facial Aesthetics, and he's also the founder of an exciting new service called Tender Healthcare. Dr. Holt, welcome to the program.
Thanks very much, Toby. Good to be here.
Oh, our pleasure. Before we get into all of the exciting things you're doing, perhaps we could start a little bit about your background. What's the Dr. Holt story?
Sure thing. So I guess I consider myself a bit of a healthcare entrepreneur, having founded the Australasian Academy of Dentofacial Aesthetics and more recently founding Tender Healthcare. However, by profession, I'm actually a dentist, and I actually think it's probably that experience working globally in that primary healthcare role. For the last 20 years, I've worked across Australasia, Europe, and the Middle East. And that's given me, obviously, insight into developing platforms that would overcome some of the traditional barriers that I've seen in healthcare delivery, both for patients and for providers, and improving the healthcare system. And I think that's where things like Tender Healthcare came from.
Having worked all around the world, every country has different healthcare systems. How would you rate Australia's healthcare system at the moment compared on an international scale?
Yeah, I think anybody that works in the healthcare industry and even patients, if they really stop to think about it, would realise just how lucky we are in Australia with the healthcare industry, both in terms of quality, in terms of education and training, regulation, and also just the cost of it as well. While we tend to think that healthcare is expensive, and it is, we are still very lucky in this part of the world.
Now, technology is always changing things, and these great systems can be improved. You've identified some areas that you think can be improved with your new service called Tender Healthcare. What is it? How does it work?
Yeah, so Tender Healthcare is a new online platform that's available in Australia, and it essentially helps to bridge the gap between patients and providers of healthcare. And it does that by breaking down traditional barriers that are geographical barriers, and it moves the interactions online. So essentially, Tender Healthcare empowers patients to better manage their own healthcare needs, while creating an exciting new opportunity for providers to deliver care in a unique way.
So if I'm looking for a provider, what's your service going to do for me? What do I need to do, and what do I get?
Sure. So it's brilliantly simple. Patients post cases onto the Tender Healthcare platform, which outline their healthcare needs, and providers will then be notified that a case that's available in their service category. They go online and they tender an offer for care, hence the name, and patients will then assess the options that are presented to them and select the best offer that represents quality, affordable healthcare that fits in with what they're seeking.
Sure. Healthcare is a pretty broad area. What type of services do you think are you aiming for with this service?
Yeah, Tender Healthcare has been designed to cater to a broad spectrum of services. So we have everything from laser vision correction through to dentistry, cosmetic surgery, hip and knee replacements, all the way up to cardiothoracic surgery. We seem to see that the cases that are presented tend to be obviously the larger ticket items, the things that require patients to also put a bit more thought into it. So I wouldn't consider that a patient would post the need for a massage or a facial or something like that onto the site. It's something where they really need to assess multiple second opinions, different treatment options, and then make an informed decision.
I think it's a great service. Are there any provisions or things to prevent people who actually need urgent medical care, that they should be going to see someone straight away, not trying and save a dollar here or there? Are there any provisions for the types of services that are available?
Absolutely, and that's the warning or the suggestion we put all over the Tender Healthcare site, that if it's an emergency procedure, then obviously we have emergency systems in place. So, our 000 system and our emergency departments at the hospital are the go-to places. These are really for services where you do have a little bit of time to sit down and think about it. And research is consistently showing us that, we achieve better healthcare outcomes for patients when they have a number of second opinions and different treatment options available to them, and they can sit down and assess that. So it's certainly not an emergency service, but by the same token, I note that you mentioned saving a few dollars there. It's certainly not a system that's purely based on cost, and I think that's where people can, certainly providers, can get a little bit misled, thinking that, perhaps this is just a cost comparison website, and nothing could be further from the truth. In the cases that we've seen on the Tender Healthcare site, I guess in a way it did surprise us as much as anybody that patients don't always go for the cheapest option that's presented. They do spend a bit of time trying to find something that fits in line with the quality that they're wanting as well as an affordable solution.
Successful businesses these days often seem to strategize to be industry disruptors. Do you see yourself as a disruptor of the healthcare industry?
I really don't. I guess the term entrepreneur or doing things like this tend to put you into that category, but my very nature of being a dentist, we're very conservative people by training and by profession. And as a healthcare professional, obviously, I'm more concerned with the outcomes for my patients. But what I tend to find, and what I guess is frustrating a little bit, is that the healthcare industry in general seems to be slow on the uptake of some new service delivery models, particularly anything that has online attached to it, that ultimately could just better service their patients and their businesses. And we tend to see it as disruption rather than being a great opportunity for everybody involved in healthcare. It's
really a great opportunity for patients to be able to get comparison. What about from the healthcare provider end? Why should I sign up? What's in it for me?
Yeah, so when I was mentioning about geographical barriers, that's applied to patients and providers consistently. So obviously for patients, we know they should get second opinions and treatment options, but that's easier said than done. We're all very busy, and to have to run around physically to multiple second opinion appointments for the same problem, not only is it costly, but it's very time consuming. But by the same token, providers have been limited geographically as well. So we choose a location to set up our practice in, and that really does lock us into the local catchment area of really whoever works or lives nearby. And that puts just a restriction on the number of people that we can cater to. So by suddenly opening up the field and being able to consult online with people across town or across the country, it helps us to expand and grow our business beyond that local catchment area. So it provides a unique opportunity to growth of a provider's business.
You mentioned saving time. How long do you expect a typical tender process to take?
So it does depend on the complexity of the case, and really one of the things we've seen is it depends on how much information patients provide up front. So as I said, the process involves patients posting their case initially, and as part of that, they can post x-rays, treatment plans they've already gotten, test results, whatever files and records, including medical history, they need to add. But if they don't provide enough, then sometimes providers will want a little bit more before they feel confident to offer a solution or an alternative. And there is the ability to have a bit of back and forward dialogue through the site. I would say typically a case could take anywhere from 24 hours to a few days.
You mentioned that it depends on what the patient posts. From your end, from the Tender Healthcare end, are you providing them with any type of guidelines and helpful hints? Because a lot of the time I imagine the patient don't know exactly what they want or what they need.
Absolutely. So, yeah, through the case posting process, we do have little hints and tips and suggestions on how to really maximize the benefit for the patient, and just to make life easier for the providers as well. So being a provider of healthcare myself, I know how restrictive it is to not have the information that you need. So we definitely encourage them and guide them on what kinds of things that they can include and the common things that they'll need to consider. But as I said, there's also that dialogue that's able to happen. So if a provider did find that there was something specific or a question they wanted to ask, there's the ability to ask that back and forward before actually offering any kind of tender for the case.
Now, you mentioned money and the price wasn't always the number one factor, but it is an important one. To use this service, are there any fees involved? What type of fees are we looking at?
No, so it's a free service for patients, which is one of the attractive things. And for providers, it really represents kind of a low-cost, focused marketing spend. So it's got an annual membership fee of a few $100s. So it's not large by comparison to what practices usually spend to recruit patients and sort of find new patients. And as I said, it's a focused spend for providers because you know that the people on this service are actively seeking the treatment you're providing. But it's not all about cost. So patients place different value on different things. And certainly when you think, for example, of somebody who might be in a country or a rural area and they don't have access to a lot of specialty care around them, and yet they don't know who to go to, and they can't easily find something. Now they can post this case online, and there may be somebody in the next town, or they would be willing to travel to the capital city to find somebody who gives the specialised care they can't access. We did some recent market research, and 79% of Australians said they'd be willing to travel outside their local area to access better quality, more affordable care. So it's a really interesting scenario we're seeing.
Sure. And what's the state of the service at the moment? Is it something that's up and running now, or it's coming soon, almost ready?
It's coming soon. So at the moment, we're actively looking for providers who are interested in providing solutions to care for patients. And we've got patients literally beating down the door to find new solutions for healthcare. So we are launching in a few weeks' time. So at the moment, we've gone through quite a few test cases to perfect the system, but we're launching nationwide within the next few weeks.
And how can other healthcare providers get involved if they think that this is something that they're interested in pursuing?
Sure. So they can go to our website, which is www.tenderhc.com. And there's a whole lot of information outlining the benefits and what's required, and they can also register directly online as well.
Excellent. And what was the name of the website again?
It's Tender, TENDERHC.com.
Well, Dr. Holt, we're quickly running out of time, but thank you so much for joining us today. It's been very informative.
Thanks so much for your time.
Our pleasure. Now, if you've just joined us on Health Professional Radio, you've just missed my conversation with Dr. Myles Holt about some exciting new ways for patients to be able to connect with healthcare professionals. The good news is that you can find this interview in full, along with all of our other interviews, at our website, healthprofessionalradio.com or hpr.fm. You can also find us on Facebook, Instagram, SoundCloud, iTunes, Pinterest, Twitter, and LinkedIn. My name's Toby Longhurst, and you've been joining us on Health Professional Radio.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.